Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Dr. Yusuf. Inshallah, today I'll be sharing a bit about IMARET's response for the COVID-19. So, if possible, we can share the slides, please. So, IMARET is a chapter under IMAM. Our volunteers mainly we have from medical and non-medical volunteers, and we focus on two response. The first one is to disasters, and locally and internationally, and also medical outreach for the marginalized communities. Next, please.
Sekejap pula, slide belum naik, sekejap.
So, for our disaster relief, so we have mainly focused locally in Malaysia for the past since 2014, and mostly doing flood relief. We responded annually until now, and also for the medical outreach, we've been providing medical and health services to the communities that lack access, and that is, for example, the Orang Asli community, the refugees, also the stateless in Semporna, or even right here in Chowkit. So, from our local medical relief, apart from flood relief, the annual flood relief since 2014, we also provided services and support during the Pasir Gudang relief, the Kuala Koh relief, haze relief. We had quite a bad haze a few years back, and also Sabah earthquake relief in 2015. And also internationally, we responded during the Cox's Bazar crisis in Cox's Bazar, Bangladesh. So there was a surge of Rohingya refugees, and then into Cox's Bazar. And then 2018, Sulawesi relief during the Palu earthquake, and also in Palestine and Zimbabwe, we've been supporting to our partners under FIMA, Federation Islamic of Medical Associations. And also, of course, our Safeware initiative. So it's basically, it's an initiative to provide locally designed field water treatment system to provide to the communities in Malaysia, also internationally. So we've been installing this Safeware in Cox's Bazar and also in Indonesia post earthquake. And Alhamdulillah, until now, we've installed at least 30 Safeware system. So next, please. So for COVID-19 relief, we've started way back on 15 March. I personally went to CPRC. It was on Sunday, like today, and we've discussed with the representative from CPRC, discussed what was the situation, and then how we can help as an NGO from IMARET. So that night, 15 March, with all our task force members, all mostly doctors and excos and previous excos of IMARET, we gathered online. That was our first meeting, 15 March, and we've decided to launch our relief effort. Next, please. And during that time, we know that during that time, it was a havoc. People were panic buying. The price of masks was crazy. So we need, what I've mentioned to our colleagues and friends, that in times of crisis, we have to be the light and show the rakyat to be strong by supporting each other. When people are on a survival mode, when people are just taking care of themselves and family, we need to show to them that nation, as a Malaysian, this is not who we are. We are always supportive each other. So that is our initial intention. So next. We during our COVID-19 relief, we formed 3 main activities from Team Alpha, Bravo, and Charlie. Team Alpha is basically to provide medical volunteers where that is needed. So we collaborated with CPRC as a main coordinator, also with other medical NGOs such as Mercy Malaysia, Nation Youth Agency, Zuchi, and with CPRC as the main coordinator, we deployed our volunteers from pejabat kesihatan daerah even to KLIA, and from Klang Valley to Sabah Sempurna. So the next activity was the Bravo team. So this was focusing on providing supplies and equipments to the healthcare facilities to fight this pandemic. And basically, it started with providing necessities for the healthcare facilities, assets such as fans, tents, canopy, and then we provided food for the frontliners. But after that, the needs are more, as we all know, in late March and early April, there was high needs in PPEs. So we formed an initiative under Demi Negara with our brothers in Mercy Malaysia MRA, funded by the Age. So we distributed thousands of PPE country, coordinated with our partner NGOs from Perlis to even to Sabah. So that was the Bravo team. We also provided medical equipments and where is needed. The third one is Charlie, where we provide food packs. Initially, the intention was to provide food packs for the communities or for the people, the person who are under home surveillance order. So they are asked to be quarantined for 2 weeks. So we provided food packs of pack prihatin to this community that mostly are B40s, and so that they can be quarantined and also can also support their families. But later on, you know that there's a need with more with the MCO extending. So even the refugees need assistance, the marginalized communities. So that's why we even collaborated with UNHCR to provide food packs for the refugees and all other marginalized communities. Next, please. So the Alpha team sent medical volunteer deployments. On the left side is our volunteers at MCO extended PKPD or MCO in Masjid India. So for City 1 they mentioned, we set up a base camp, and then we sent our medical volunteers so throughout Klang Valley. And then on the right side is where our volunteers in depot, Bukit Jalil depot, immigration depot. So this is the Alpha team where we provide all the medical volunteers as per need, in collaboration with the CPRC. Next, please. So Bravo team, we provide medical equipments and supply distribution. So start with the left picture is one of the early health clinic in Shah Alam. We provided portable aircons for the clinic. And on the right side was in HKL, where we provided ventilators, portable ultrasounds, and efficient pumps to be used by the HKL emergency department. So next, please. And we've been providing also set up medical base at all these MCO areas. The left one was in Masjid India. And we, apart from medical base, we provided all the necessities such as medical equipments and medical supplies. So it started with Plaza City 1 and then Masjid India medical base. And later on, we provided for other need, red zone areas. Next, please. And also this one later on, when there were increase of cases among the in the immigration depot, and then most of them placed in the IMARET low risk center. So there was a need for even close. So apart from PPEs and all the medical supplies, there are also needs in the immigration depot or for the patients at the low risk center to provide clothes. So we collaborated with our partner NGOs, Kembara Caremonger. Then we provided with the help of the Malaysian public. Alhamdulillah, we managed to provide to the Malaysian Depot and the MAEPs. So this was early, probably in May. But now, as we know, MAEPs has already reopened, and we just sent another assistant to them yesterday. Next, please. So food packs distribution start way back early when there was a home surveillance order for the B40. So we provided food packs for them. And later on, in collaboration with our partners, local NGOs, and also the community, B40 community, also UNHCR, we provided food packs. Alhamdulillah, this was in Selayang, on the right side. So in collaboration with our other NGO partners, we coordinate so that our assistance are not overlapped with other partners. Next, please. So later on, after about in July, I think in August, April, there was Alhamdulillah, the cases in Indonesia reduced, but our Indonesian brothers and sisters in Indonesia, the cases are increasing, and at one time they were the highest in Southeast Asia. We note that this is a pandemic, that because of a pandemic, it's all over. So it's beyond our own border. So our team have been emphasizing, if our neighbors are not, the cases are not reduced, then there is high risk that also we will have another wave that happened during the third wave, as you've seen. So during that time, we responded by providing the needs there was N95 mask, and with a hashtag kerana kita bersaudara. It's not just provide the during that time, I think it's about 50 doctors who already passed away because of COVID. So the needs was really high in terms of N95. There were no stocks over there. So we've managed to send there, and 5,000 N95 masks, and Alhamdulillah, we've managed to send. But as we know, again, next please. As we say, emphasize that if our neighbors have high cases, especially in Philippines and Indonesia, we will have another wave. So that is what happened during the third wave. It started in Sabah. Mostly it started as there was increased people coming in from Indonesia and the Philippines, and the third wave started. So we've responded from October, and then we've started way back in Sabah. We're providing assistance to the Tawau prison and Tawau hospital, and also nearby clinic kesihatan. And later on, we provided also main epicenter during that time was in Sempurna. So we provide assistance in terms of PPEs, medical equipments, and later on we provided medical volunteers. So next, please. So the third wave, we've responded our first team by sending our medical team, 6 doctors, 6 personnel. Our team Alpha, there was 3 doctors and 3 allied health personnel. So this team, we've trained them to do RTK antigen kit, RTK antigen test on field. So it has been introduced, and Alhamdulillah, because of that, this team have successfully shared the methodology. Apart from assisting the pejabat kesihatan daerah Sempurna, we collaborated with them, and then the system of using RTK antigen and open lab, it was really improved the system to provide immediate point of care testing. So next, please. So this is one of the islands that we went. And because it was very difficult, it was very challenging in terms of logistic. So with the previously they had to send results. Had to send the test from the islands and then to the mainland and then to Kinabalu and even flew it back to Klang Valley. So with the RT-PCR antigen test kit, we can test right on the same day and get the result, and right away we can isolate patients. So Alhamdulillah, first team managed to stay there for 2 weeks, and the subsequent team. So in total about 1 month with some of volunteers. Next one. And we also deployed our volunteers from 2 anesthesiologists to assist the opening of the Sempurna Hospital. So Alhamdulillah, with in collaboration with the Sempurna Hospital and their support, we managed to assist them in opening this operation theatre. And Alhamdulillah, after 13 years, the OT was reactivated and they managed to do the first Caesar after 13 years. So last week, apart from deploying our anesthesiologists to reactivate the operation theatre, they also assisted by sharing the knowledge with the medical officers there. So it will be sustainable to continue the anesthesiology service there. If not, they had to send their patients from Sempurna to Tawau just for Caesar for at least 2 hours on the ambulance. So it has really reduced the time. Thank you. Next, please. And also after the third wave, we know that now it has spread in Peninsula. And of course, starting opening of the low risk centers and then more sampling is done. This is one of the low risk center in Port Dickson, the only low risk center in Negeri Sembilan. So we've supplied needs such as dry rations and also clothes for the patients there. This is actually not the patients, even though they are wearing patients' clothes. These are actually the health worker, because that's not enough scrubs for them. So next, please. And now we are actively assisting the operations in the highest in the district with the highest cases in Malaysia, which is Klang, Selangor. And this we set up the medical base in the AMCO Top Glove Hostel. So we provided assistance in terms of the medical base and also other needs such as walkie-talkies and then handphones for the contact tracing. And next, please. And then we also provided assistance in terms of volunteers. So Alhamdulillah, in collaboration with Selangor Task Force and also Pejabat Kesihatan Daerah Klang, so we are currently actively assist in providing more mass sampling in the community to target this area which is high risk and to isolate these patients as soon as possible. And even as I'm speaking today, our team is doing mass sampling in Meru. I think right now we are targeting about 500 people. So hopefully everything goes well, and we hope that this surge of wave start in Klang and all around Selangor and also in the whole of Malaysia. We hope that with the assistance and support and dua from everyone, we can win this war, inshallah. Next, please. So this is our team in Klang. So basically, apart from the Selangor state team, our team is supporting in terms of the open lab. So we do RT-PCR antigen test, so we can get the result on the spot the same day and provide to the Pejabat Kesihatan Daerah Klang to do the next isolation of this patient and to do more testing if needed. So this is our team right now. We have 12 people, 12 volunteers currently doing mass sampling in Klang. Next, please. So lastly, this is our volunteers. The most, I think, the 16 of our team are doing mass sampling in PKPD Top Glove. So alhamdulillah, inshallah, we hope that this PKPD will resolve, and we hope that all of these cases, we hope that there'll be an increasing number of cases we'll see, because we are doing more testing. But hopefully, when we do this, we can isolate and we can break the chain of infection of COVID-19. Thank you. I think that's all for my slides. Next. Okay,
Alright.
that's all. Thank you.
Sekejap kita akan masuk kedua. Alright, thank you very much Dr. Munawwar for the updates, and Alhamdulillah, with all the achievements, I would like to take this opportunity to thank all of our volunteers, our partners, our donors, our sponsors, and support, and also followers for the continuous support. And just to remind you that the donate button below your stream window is not a scam button. You can click and see through all our programs and activities, and your donation can continue to help us to help those in need. So alternatively, you can donate directly to our CIMB bank account, and the details will be shown on the screen after this. Now, thank you again, Dr. Munawwar and the IMARET team member for your continuous work. Stay safe, kita jaga kita, and let's continue the fight.